Welcome back. In this session, we will be discussing a new lesson that is titled Reproductive Health. In the previous videos, we have discussed about human reproduction, and you are now familiar with the process of reproduction in human males and human females. Now, in this lesson, we will be discussing about various health related aspects of reproduction. Simple definition: reproductive health can be defined as when people have normal reproductive organs which are functional. According to World Health Organization, reproductive health can be defined as the total well-being in all reproductive related aspects. A person is said to be reproductively healthy if he or she is physically and emotionally fit, as well as they display normal behavioral and social behavior in terms of all sex related aspects. Such society can be said to be reproductively healthy. Now, this lesson is very important because of various problems in the world, mainly concerning with population explosion and all sex related crimes. India was one among the first countries which started this as early as in 1951, soon after independence, under the title family planning, wherein impetus was laid on having small and manageable families, basically nuclear families. Now, all this family planning can be together studied under the head called as RCHC, Reproductive and Child Healthcare Programs. So, these programs, they had the basic objective of doing the same thing, that is, point number one, creating awareness among people regarding a reproductively healthy society, regarding all sex related aspects. And on the other hand, the second objective was to create all facilities and supports available to implement these plans. So let us discuss about both these objectives in detail. So, creating awareness among people is very important. Parents, teachers, relatives, friends all have a very important role to play, along with the help of audio and visual media and also print media. These have been effectively used to create awareness among people. Among these, one of the important steps is introduction of sex education in schools and colleges. Right in the NCERT textbooks, in class 8 itself, we are introduced to the reproductive cycle in human beings, which is once again repeated in class 10th, and in class 12th again this topic is included, so as to create awareness amongst the youngsters. And when these lessons are included, they also prevent or discourage the spread of myths and misconceptions regarding sex related aspects. All the wrong notions that youngsters might have related to sex and other aspects will be dealt with. So, prevention of or discouraging the myths and misconceptions is one of the objectives. Also, this helps in providing more information about adolescence. Adolescence is a stage wherein there are a lot of physical, physiological, hormonal, emotional changes going on in a youngster. The youngsters may not necessarily know how to handle all these sudden changes in their body and in the physiology. So, providing information will help them to better cope up with the sudden changes. Also, information related to the hygienic and safe sexual practices are very important to prevent the spread of sexually transmitted diseases. So information relating to safe sexual practices are also included in these topics of sex education. Educating people, especially fertile couples, regarding the available birth control options. These are very important in order to control population explosion and to have sizable families with few members. People should be aware of the birth control options. For example, under the theme of family planning, various programs were conducted to spread this information. Slogans like "Hum do hamare do" means promoting only a maximum of 2 children per family, or recently it is having only 1 child per family. So this requires knowledge about birth control, about which we will discuss later. Also, knowledge about proper care of the mother, prenatal care and postnatal care are very important in reducing the mortality rate of both mother as well as the child. So during the past few decades, there has been a significant decrease in the death rate of maternal as well as the child. Also, educating the mother about breastfeeding and its importance to prevent any diseases in the newborn child. All this will come under creating awareness, and most importantly, to promote healthy sexual society. It is very important to prevent the sexual abuse and all sex related crimes, both in children as well as in adults. So thus providing information will help us to create a reproductively healthy society under the RCH program. To back up all this, if these have to be implemented in action, we require strong infrastructural support in the form of clinics, diagnostic laboratories and hospitals, which are essential. So that will come under providing facility and support. So opening of state-run or district-run hospitals, which will give low-cost, affordable healthcare to people belonging to all communities, is very important. When we talk about reproduction-related crimes, one of the important crime is female feticide. Especially it was seen in India and other neighboring nations, wherein if it was found out that the newborn is a female, so these infants were killed. Also, certain clinics or hospitals were offering sex detection tests, wherein a couple could identify the gender of their child before it was born, and once it was known that the child was a female, they used to go for abortions, either legally or illegally, which in some ways would affect the child of the mother also. So one such technique is amniocentesis. This is a gender detection test wherein the amniotic fluid from the fetus would be collected. The cells from this amniotic fluid would be studied under microscope. These cells would reveal the number of chromosomes and type of chromosomes, wherein it would help to identify the sex of the child. So there is a statutory ban on amniocentesis, especially in India, because it was used for illegal female feticide. In essence, it was actually meant for diagnosing the proper development of the child and to know whether the child has any genetic or birth defects and to take appropriate actions. But it was used illegally for female feticides, so now it is banned. And also massive child immunization programs have taken place under this. For example, the pulse polio vaccination program, the BCG vaccination program for small children. All these are very important in creating a healthy society. So these are all objectives and actions that are part of the RCH program, Reproductive and Child Healthcare Programs. Now, all this play a very important role in controlling population explosion. That is what we will discuss next. Now, in the past 4 or 5 decades, the population explosion has been a major problem. Why is this happening? Because of the advanced lifestyle of people, improved nutrition available, and also the improved medical facilities that are available. All these have contributed to higher life expectancy, reduction in the number of diseases. Therefore, the reproduction rate has increased. Not only that, population explosion, due to the improvement in lifestyle and medical facilities available, there has been a decrease in the death rate and there is a decrease in maternal mortality rate. That is, during childbirth or after childbirth, mother used to suffer from operational injuries or any other issues resulting in death. So that's what is called as maternal mortality rate, death of the mother. Also there is a decline in infant mortality rate due to better medical facilities. So in olden days, the infant mortality rate, death of the child, was very high, and also there has been an increase in the number of people in the reproducible age. Take for example India. During independence, India's population was roughly 35 crores. By 2000, this had increased to 1 billion. That is almost 3 times more. And the 2011 census shows the Indian population at around 1.25 billion. So there has been another addition of 250 million more people. In the next census, we will get a much better picture about the growth rate, population growth rate. Currently, the population growth rate is 2% per year. That is, 20 people are increasing for every 1,000 people per year. Compare that with the current 1.35 billion population that we have. A 2% growth rate is very alarming. If the population growth continues at the same rate, it would result in various issues, mostly social issues, economic problems, and also problems related to food, health, and security. So, population explosion results in other issues. Therefore, one of the important tasks the government has is to control the population explosion, for which the country has undertaken 3 major plans. Plan number 1 to control population explosion is to encourage or promote small families and to incentivize small families. That is, to create awareness among couples and people who are about to get married about the advantages of a small family. That is number 1. And number 2, to incentivize those families which have either 1 or 2 children. So to provide additional medical facilities, incentives, etc. Other than these 2, also government is looking at the various birth control options. That is, what are the possible contraceptive devices that are available which will help to avoid pregnancy or which will help to delay the pregnancy. So that is what we will be looking at in detail right now. That is the different types of contraceptive methods that are available to control the population explosion. Contraceptive. Section means to give birth. Contra means against. These are devices or methods available to prevent pregnancy or to delay pregnancy. So we will discuss about the various contraceptive methods available. So a ideal contraceptive device, it should be easily available. That is very, very important, and it should be easy to use without any other assistance from doctors or nurses. They should be able to use themselves. That is one. Most importantly, it should be effective. That means it should be able to prevent unwanted or unnecessary pregnancies. It should be effective and it should be reversible. Reversible meaning once the individual stops using these contraceptive methods, he or she should be able to reproduce, mostly in the case of females. So they should be able to get pregnant. So it should be reversible, and it should be, of course, it should be cheap so that more people can afford these techniques, and there should be little or no side effects. This is very, very important. Of course, in contraceptive method, we are going against the natural reproductive cycle, that is preventing pregnancy. Therefore, there will be certain side effects when we use these methods. So, while choosing these contraceptive methods, we have to balance, we have to weigh in all the options, the advantages as well as the disadvantages. Some of the few side effects could be irritation, slight abdominal pain, or nausea if taking these in form of tablets. Also, there could be irregular menstrual cycles, heavy menstrual bleeding, and also cases of cancer. So, although not many, these are the possible risks involved in using these contraceptive methods, although their advantages are many. So, let us discuss the different types of contraceptive devices. The first contraceptive method is called as natural method or traditional method. The advantage of this method is that it has no side effects at all. This is because it does not use any tablets or any devices. So it is purely natural. And what happens in the natural method is it will avoid the meeting of the ovum and the sperm, therefore preventing fertilization, hence preventing conception or pregnancy. So in natural method, there are three simple techniques to avoid the meeting of ovum and sperm. Technique number one is called as periodic abstinence, which is very simple. So in the periodic abstinence technique, the knowledge of the menstrual cycle is very important. So here in this technique, couple will avoid having sexual intercourse during the menstrual cycle, especially from days 10 to day 17. As you already studied about the menstrual cycle, we know that this is the very fertile period, meaning ovulation, release of ovum happens during this duration, that is from in between day 10 to day 17. So not having sexual intercourse during this period will avoid the meeting of the ovum and the egg, and therefore ovum and the sperm, therefore preventing fertilization. Method number two, coitus interruptus or withdrawal. In this method, the male partner withdraws his penis from the vagina just before ejaculation. So, this will prevent insemination inside the female reproductive tract. This is what is called as withdrawal method. The third method is lactational amenorrhea. It is a known phenomenon that when the mother is breastfeeding the child soon after childbirth, the levels of progesterones in the body are very high along with estrogens. This will result in no menstrual cycle. Hence, there is no ovulation during this period. Lactational amenorrhea, that is no menstrual cycle. When the mother is breastfeeding the child, menstrual cycle is absent, hence ovulation is absent. But it is known to last only up to 6 months. All these are natural methods. The side effects are zero, but the chances of this technique failing are very, very high. Therefore, these methods cannot be completely trusted upon. The second contraceptive method is barrier method. As the name suggests, we are creating a barrier or a wall. What does it do? It prevents the meeting of the ovum and the sperm. These barriers can be worn by both males as well as females. For males and females, we have condoms which are made up of rubber or latex, which are worn on the penis or worn inside the vagina by the females. So they prevent the semen from entering into the cervix. Therefore, the sperms cannot meet the ovum, hence it will prevent fertilization. One added advantage of barrier method is that they also offer protection from sexually transmitted infections and also from the deadly HIV/AIDS. So they have this advantage of offering protection from STIs. Other than the condoms, there are devices which are meant only for females, for example diaphragms, cervical caps and vaults. As you can see, these are worn by the females and they prevent the meeting of the sperm with the ovum. Along with the use of these, they can be used along with certain spermicidal creams or jellies which will increase the efficiency of these contraceptive devices. These barrier methods are easily available in medical stores. It can be used by the individual themselves without the help of any doctor or nurse, and it is easily disposable, and it has almost zero side effects except from maybe irritation. So that is about the second technique, that is the barrier method. The third method is called as intrauterine device or IUD. As the name itself indicates, these are devices that are inserted in the uterus with the help of doctors or nurses. So as you can see in the diagram, these devices are inserted through the vagina within the uterus. So these intrauterine devices, they work in one of these following ways. So either these devices, they will produce certain hormones which will increase the cervical mucus. So the mucus will become thick near the cervix. This will help in trapping the sperms and killing the sperms. So that is one way. Second is phagocytosis of sperms. Like I already told you, the sperms, their motility will be affected or the sperms can be killed, phagocytosis. Also, they can change the lining of the uterus, therefore making the endometrium lining incapable of attaching to the fertilized egg. So that is one way of preventing pregnancy. They can also prevent ovulation due to the hormonal action, and they can prevent implantation because the uterus lining has changed. The fertilized egg cannot come and attach to the inner lining of uterus. All these are the methods by which intrauterine devices act. There are three types of intrauterine devices which can be classified as non-medicated IUDs. For example, Lippis loop. It will simply change the uterus lining and also it will help in phagocytosis of sperms. Then we have the copper IUD. So CUIUD. For example, copper 7 multilode 757, copper T, etc. So these are devices inserted within the uterus. They will release copper ions. The copper ions will increase the local temperature, thus resulting in phagocytosis of sperms. They will inhibit the sperm motility and they will kill the sperms also. That's how copper IUDs will act. And the third type of IUD are your hormonal IUDs. Hormonal IUD, for example, LNG 20, progestasert. As the name suggests, the arms of the device, they release hormones. Mostly these contain hormones like progestogen or a combination of estrogen and progestogen, which will once again affect the cervical mucus quality and uterus lining, therefore preventing ovulation or preventing implantation. So these are the three types of intrauterine devices and their mechanism of action in preventing conception or pregnancy. The next type of contraceptive device available is the oral pill method. So in the oral method, this is meant for females only. The female takes certain tablets called as oral pills. These pills generally they contain hormones, maybe estrogen only or a combination of estrogen and progestogen. Because of taking this pill, there will be a hormonal imbalance in the body which will prevent ovulation. Because ovum is not released, this will hence prevent pregnancy or conception. There are different types of pills available. For example, there is a pill which has to be taken for 21 days. So if you look at the female menstrual cycle, which lasts for 28 or 29 days, the first 7 days is the menstrual phase. So soon after the menstrual phase, females have to start taking this pill. So that is ideally from 5th day onwards or from the 7th day onwards till the menstruation cycle ends. That is till the beginning of the next cycle, and they can give a break for 7 days and once again start continuing the pill. Till the time the female continues this pill, she will not be able to reproduce. Most of these pills are made up of steroids, therefore these will have obvious side effects on the female body. Hence the CDRI, Central Drug Research Institute of India, has produced a non-steroidal oral pill which is named as Saheli. This is known to have least side effects and this can be taken once in a week only, therefore further decreasing the side effects. So oral pills, they work on the principle of prevention of ovulation. Then we have other techniques which are not so commonly used, for example, implants and injectables. In the case of implants, a plastic based flexible tube is implanted below the upper arm. This is for females. So with the help of doctor's services, it is implanted over here, as you can see in the diagram. This plastic tube, it will release the hormone estrogen or estrogen plus progesterone in small doses regularly. They are known to have a lifespan of around 3 years. Means once implanted, it will work soon after, immediately, for a period of 3 years. It has certain side effects obviously because steroid hormones are being used and it can cause certain irritation. If an irritation is there, it can be removed and once again re-implanted. That is about implants. And then we have injectables. Injectables also work on the same principle like implants and oral methods. A injection is administered to the female, which contains mostly estrogen or estrogen plus progesterone combination. These injectables are very important, especially in cases of sexual crimes like rapes. So these injections can be quickly administered to the victim to prevent any unwanted pregnancy. So that can be done.
The next method is called sterilization technique or surgical method. This method is irreversible, meaning once it is adopted, the male or female cannot reproduce again. In this technique, in males it is called as vasectomy and in females it is called tubectomy, wherein in males the vas deferens is cut and tied, whereas in females the oviduct or fallopian tube is cut and tied. Thus, this will block the transport of ovum and sperm, therefore preventing any fertilization. This is one of the techniques with the highest percentage of success rate.
So these are all the different contraceptive techniques that are available to avoid pregnancy, unwanted pregnancy, or to delay the duration between two pregnancies. Their mechanism of action is discussed. Their advantages and disadvantages are also discussed in detail.